You and I in a series of getting and staying healthy together. Good morning. This is Rhett Palmer. Let's continue to talk about good health with Dr. Frazier. I'm glad to have him in here, by the way. He is the doctor that runs Vero Cosmetic Surgery and Medispa, along with Dr. Bailor over there on 37th Street, plastic and reconstructive surgery. We're talking about liposuction. Now, we've learned today that fat cells will not come back. And that's a good thing. Okay, what is liposuction along with a tummy tuck?
Well, frequently you have both excess fat that is diet resistant, and that we sort of mentioned you can only remove by liposuction. You can't diet it off. But also there's been some stretching of the skin. For example, pregnancy is a classic example. And so these people have some diet-resistant fat in the center of the abdomen and loose skin. So you can remove that fat. Now it's a thinner layer, and then tighten the skin by removing some of that, just like you would alter a shirt or a skirt or a pair of pants. You take some of that skin out and sew it shut. It's a very low incision, and it makes the abdomen nice and flat.
What do you think about gastroenterologists and getting that gastro surgery that, you know, like 2 people out of every 200, I believe, die? I'm not sure, but I think I read that somewhere.
Yeah, there's gastric bypass, which was the original, and that's been around for 30 years or so. That creates a lot of physiologic changes and potential problems.
Now, if you're morbidly obese, yay, but if you're not, you shouldn't do that?
No. The people doing that kind of surgery have criteria for who's a good candidate.
Go see them, like Dr. Dumkowski up there and Sebastian.
Sure. But there's a relatively new procedure, probably 5, 6, 7 years now, called a gastric sleeve. So they don't disrupt or change the basic architecture of the gastrointestinal tract. They just make the stomach smaller. And they take out part of it in a way that lets you still digest food, but you only will be able to eat about 4 ounces at a time.
But I've known people to get that, and then they stretch that sucker out, and they end up eating just as much and gaining back the weight. I don't mean to be hard-nosed here, but I want to, you know, for my listener's sake, for let's just be honest. We're looking for authentic voices. Well, Brett's going to be authentic with you. You know, I lost this 30 pounds by prayer to a power greater than myself to help me. And by doing the shakes, by listening to the people around me, the experts on taking protein shakes, and then by having an exercise coach, workout coach, these things, and I submitted. Those disciplines are now changing my life. Whereas if I paid somebody else to liposuction me, to give me gastro, you know, surgery and everything, you know, these people haven't gained anything except like the lazy person's way out. Well, and let's call it an ace, a spade, or whatever you want to call it. You know,
well,
I don't know.
And that's true, and that's the problem with a person who does not take responsibility for themselves. I mean, you've got to own it. You own your lifestyle, and if you hire somebody to own it for you, it's sort of like the soldier who hires somebody else to go to war for him.
A mercenary.
Yeah, and so this is a situation where the gastric bypass or the gastric sleeve fits in along with the pills that we mentioned before that were back 20, 30, 40 years ago. They're still around. The fad diets, all these things are ways that people have of saying, I don't really want to invest personally in this. I want somebody else to do the heavy lifting.
Yeah.
And in fact, what you're talking about, where you pray about it, you commit to exercising, you commit to changing your diet, you make a lifestyle change.
It's so rewarding.
Oh, absolutely. And people will tell you they feel so much better.
Do I cheat? You're damn right I cheat. Do I go over to Sweet Kiss and, you know, surreptitiously or kind of clandestine fashion make my way over there and have some of that gelato? Ooh, it's so good. But only once in a while. And then what I do is if I get off the horse and I have some of that gelato, the next hour, I don't go, well, this day's ruined. No, I'm back on it again. I'm still going to go exercise. I'm still not going to eat carbs at night, not many of them, you know. I'm still going to get right back on the horse when you cheat. And we're all going to cheat a little bit. But because if you don't, I think you'll blow the whole thing, right?
Well, I think one of the biggest things that's changed in the nutritional area, though, is the recognition that wheat and most other grains, flours, things like breads and crackers and coverings on the foods that we eat, all these things are really not good for us. And so that change, you know, one of the names is a paleo diet. Well, that's a good diet. But each person has to.
What is a paleo?
It's called a paleo diet.
I've heard of it, but
is high in carbs and high in
carbs.
I'm sorry, high in proteins and high in short chain fats that you can burn easily and that don't
like
cause
coconut oil, olive oil.
Exactly. And
what about vegetables?
You need high in vegetables, and you have to be cautious about the kinds of fruits you eat because some are very high in sugars. And others,
like recently, somebody said banana. I never knew that.
Banana will increase. It has a high glycemic index. It increases your blood sugar, just like the 2 pieces of whole wheat toast that we talked about.
More than a Snickers bar.
Yes,
2 pieces of whole wheat toast will actually raise your sugar level
higher than a Snickers bar.
Phew, boy, yeah. That's something.
So,
to carry
but we're learning about.
I think I'll go have a Snicker bar.
we're learning about how nutrition affects our lives.
Yeah,
and for example. We see a lot more people having joint replacements now than they did 20, 30, 40 years ago.
Because of the weight.
Weight is one of them, but chronic inflammation. And that chronic inflammation comes from the things we eat.
Inflammation. I remember Gloria Estefan happens to live here, and I've met her a few times. I've yet to do an interview with her. But, it's funny that she lives in town here because I was part of the Miami Project for Paralysis because my friend Joe Bove's son was paralyzed. And she was one of the first beneficiaries. Because Nick Bioconte, I think he was the famous ball player. It was his son that was in it too, and Joe Bove up north, who was a golf pro. But we started that years ago, and then the research was done. By the time Gloria Estefan had her accident, which everybody forgets about. I hope she doesn't. But she just has a brand new show opening on Broadway and blah blah blah. It's already open, I guess. But anyway, she because they knew about this inflammatory thing, they went right in, kept the inflammation down, and bingo, she walks today. So, for some reason, why, Dr. Frazier, is inflammation so dangerous? And why, if it's so dangerous, then why does the body do that?
Well, it's reacting to things that are put inside the body. And that's where one of the things that we're learning about is these high-carb diets and the types of things that are included in that.
High carb or high protein?
High carb.
High carb diets.
And so you're having wheat and other causes that when those break down, gluten is something you'll hear about a lot.
Yeah.
And the breakdown products of that cross the blood-brain barrier, get into the brain. There's probably going to be shown to be a relationship between Alzheimer's and dementia and that kind of phenomenon. But it also is what creates inflammation in blood vessels. And so we see cholesterol being deposited on top of the inflammation. So they said, well, this must be cholesterol is bad. Well, it's because you don't look underneath it and see the inflammation. It would be like saying every time I see a Band-Aid, I lift it up, there's a cut underneath. Band-Aids cause cuts.
Yeah, really.
No.
Well, I was in a car accident. I was in 2 car accidents years ago. And one, it was over in Sarasota and some guy in a truck, and it was a rainy day, whatever. So about maybe, let's say $5,000-$6,000 worth of damage to my vehicle. He was totally at fault. He got out and told the police that. But anyway, within 2 months, I started to have an effect from that. I started to have slurred speech. This is when I first started the radio show, 23 years ago this was. And then, but after a couple of years, it did heal. But there were other things, aches and pains and stuff. Next time I had a car accident, happened to be here, and some guy came whizzing by and turned my car. Oh, it's a long story. But anyway, it was like $13,500 worth of damage. So I'm just comparing the prices, how severe the accidents were. I immediately called a massage therapist that day and had therapy. Next morning, another massage to take the stress out of my body. You know what? Never had a problem. But I did that for a number of days after the accident. The massage took the stress out. And I find if you take anti-inflammatories like, Advil or something, it does more than just take care of the pain, doesn't it?
Yep. Well, we're learning a lot more about these things as time goes by. And we're still just scratching the surface of understanding inflammation and diet and the interrelationship of these. But I think one of the kind of interesting phenomenon is when you look at food companies, there's about 5 of them, and you look at drug companies, and there are a number that are very, very large. And the food companies are, in effect, selling to the public foods that create many of these problems, obesity and childhood diabetes and so forth. And then the drug companies sell the drugs that help to deal with the symptoms caused by the food company. So we're beginning now to change. Places like Whole Foods, right? They're saying, hey, we can do better.
Let's take a break, and we'll talk about doing better when we continue our conversation with Dr. William Frazier, plastic and reconstructive surgery. Vero Cosmetic Surgery and Medispa over on 37th Street. The number is 772-562-2400. 562-2400. When we continue, we'll talk about that, those 5 big food companies, and has a crime been perpetrated upon the American people? This is the mayor of the airwaves. Hey, who's looking out for you, baby? I am. That's who.